about pregnancy care, all what you need to know during the entire 9 months. I am sorry for the disturbance which you'll be hearing around. I apologize for that. So let's begin with a few things which I have taken into consideration, which will be important from you in the long point. So let's get into Indian mythology. We've all heard about a few stories which we have heard in our childhood when King Dashrath was given some key by Brahma so that he could have Ram and the other kids. And also, when we go into Mahabharata, Kunti was given some mantras which she could recite and have the Pandavas and Karna. Sadly, we live in this era where we don't have all these facilities, and I guess nobody has this privilege too. So, can we do? Coming to preconceptional counseling, which is very well not accepted or not even aware. People are aware about these things. Preconceptional counseling means what do you need to do when you need to have a baby? How do you plan about it? Most of the time, the first visit to a gynac from a patient comes only when she is pregnant or not having a baby when you have infertility. That is where preconception counseling becomes important. So you know when you need to have a baby and what are the precautions or what are the tests which you need to do before planning a pregnancy. So there are a few things which become important. Firstly, a general status, which takes in consideration your age, your lifestyle, your smoking, your other practices like diet, what you're doing at work, and all those things. Apart from that, there are a few investigations which are important. So basically, there are fertility markers which are done so as to find out how fertile you are. So for women, there is something which is called as AMH, that's anti-Mullerian hormone test. That lets me know how fertile you are. And for similarly for the male partner, so that they don't feel left out, there is something which we do which is called as semen analysis. After that, there are a few things which are other, apart from these things, the other blood tests which include your basic hemoglobin level, your sugars, your thyroid, your prolactin. These are the basic hormones which are required. And two viral markers, that is rubella and varicella. Sounds Greek? So rubella is German measles, varicella is chickenpox. So we basically test whether you're immune to these things. A positive report is good. If you're not immune to this, we make you wait and vaccinate you for this. And then only can you have a pregnancy. Why? Because if you have this infection during your pregnancy, there are higher chances that the baby might have any cardiac defects, that is heart defects, or a smaller skull, smaller brain, or cataracts and deafness. So that is how we plan about when you want to plan for a baby. There are other few things which you should know coming to this era again, that women are more into careers and they are more work oriented. So what do we do? So there are two things which you can do. One is egg freezing or oocyte freezing. Just pardon me for a minute. Are you going on live? Sorry for that. So there are two things which can be done. One is egg freezing or oocyte freezing, wherein your eggs are stored inside an IVF lab, and whenever you plan to have a baby, you can retrieve those eggs. Similarly, there's something which is called as embryo freezing, where an embryo is prepared. Embryo means your egg and your partner's sperm, they are fused together and made into a small baby. That's embryo, and that is stored into the lab. And whenever you plan to have a baby, you recover it from the lab and just that's implanted inside your uterus. Why again these things become important? Because with age, the quality of your egg goes down. The AMH, which I mentioned as the fertility marker, that tends to decrease. So the egg quality is not very good. And secondly, there are higher chances of you having a baby which can have chromosomal abnormalities, like Down syndrome or any other syndrome. That is why age related risks are more important whenever you are planning for a baby. For example, if you plan to have a baby at the age of 35 onwards, there is a chance of 1 in 350 pregnancies that you can land up with a pregnancy that has Down syndrome. Similarly, when you reach the age of 40, the percentage comes to 1 is to every 100. And at 45, at the age of 45, the chances are every 1 in every 30 pregnancies. That's a very high risk. So these are all the preconception advice that you need whenever you need to plan for a baby. Now coming to pregnancy, what happens and how do we go about it? So basically, what is an obstetrician? I'm an obstetrician. So obstetrician is someone who looks after your pregnancy for the entire duration of 9 months and helps you to deliver and plans your delivery. That is what we do. Ideally, the term obstetrics comes from the Latin word which is called to obstetrics. That is to be around you, to be besides you. And that's the only thing which we intend to do during the entire 9 months. Your 9 months are divided into trimesters. That's first, second, and third trimesters. So that's divided upon into number of weeks. Very basic. Whenever you want to calculate a pregnancy week, so we divide it into 9 months and 7 days, and that is how we start adding it up. So your last period date that is taken into mention. You must have heard your gynec asking about this. What is your last period date? Last period date. That's a frequent question we come across everyone, your radiologist, your sonologist, or your gynecologist. From the last period date, we add 9 months and 7 days to it, and that gives me the expected date of delivery. That's EDD. That is roughly when you're expected to deliver. Ideally, in ideal scenarios, only 10% women deliver at the expected date, whereas it happens around or before the expected date. Now, divided into trimesters, which I already told you, the first trimester goes from one first week till the 13 weeks. The second trimester is from 13 weeks to 27 weeks, and the third trimester is from 27 weeks onwards till the delivery. Term deliveries means when you reach 37 weeks and plus, that is what we call as a term patient. That is the good time to deliver. Now we divide it into trimesters. Let's come into different issues that you can face in every trimester. The first trimester, when you have a baby or when you're expecting, like you have morning sickness or other things which tell you that, oh, you missed your period, and then you do a pregnancy test and that comes out to be positive. That is when we say that you're pregnant. Ideally, the urine pregnancy test shows a positive report when the beta HCG, that's the hormone which rises when you're pregnant, crosses a value of 50. But the best test as gynacs, what we prefer, is a serum beta HCG. That is when the value reaches around 5 or more. So, whenever in doubt, a blood beta HCG level is the one which we look out for. After the beta HCG is positive, then we move on to the other investigations. So whenever you find out, yes, you're pregnant, so now you need to do certain blood investigations, which are basically called ANC profile, antenatal care profile. So in that, you do the hemoglobin, you do a basic urine routine test, your sugars, your thyroid, and again your basic kidney markers, basic liver markers, so that we know that your kidneys and the livers are functioning well, and we can have a baseline which can be correlated if anything becomes abnormal over the next 9 months. Apart from that, medication wise, there are very few things which we start on. So basically, we start you on a folic acid tablet. Folic acid, why? Because folic acid is known to prevent you or protect the baby against some neural tube defects, that is, some brain and spinal cord defects, which are very dangerous for the baby. Therefore, once you start planning a pregnancy, and even when you're pregnant, throughout the entire 9 months, the folic acid needs to be taken every day. Then you do a sonography. A sonography is usually advised roughly at around 7 weeks. 7 weeks when we see the heartbeat of the baby and we tell you, yes, the baby is good and the baby is inside the cavity. If by any chance the baby is outside the cavity, supposedly in the tube, that is not a good pregnancy. That is what we call as ectopic pregnancy, and that needs to be terminated. Now, that's the first trimester. The few side effects which you can face in the first trimester are vomiting, which we usually call as morning sickness. That can be prevented by either changing your diet or taking some medication which reduces your nausea and vomiting. Apart from that, some antacid if you face any acidity issues. The more important things you should understand are that you should avoid any bumps, any jerks, any sex during the first 3 months. The pregnancy is just attaching to the uterus. So any stress, any trauma to the baby during that period might be detrimental for the baby and can lead to miscarriages. Therefore, the basic things avoid bombs, drugs, and sex just helps us to maintain the pregnancy at a good state. Now we come to something at the 12th week, 13th week mark, which is between your first and the second trimester. At that time, we do an important sonography, which is called as the NT scan. The NT scan or the nuchal translucency scan is basically done to find out any neural tube defects again, which can be correlated to Down syndrome or any other chromosomal syndromes. This becomes an important sonography during the entire pregnancy. Along with this, certain blood tests can be advised, basically something which is called as a dual marker. A dual marker checks in the blood levels and that is correlated with the NT scan report and that gives me an 85% predictive value whether the baby can have any Down syndrome or not. Similarly, that blood test can be advised between 16 to 20 weeks. That can be called as triple marker and quadruple marker, but the sensitivity is not as good as what we get in the dual marker. That's your first trimester. Very good. If you have completed the first trimester, now you can go and announce to the world that you're pregnant. We are usually very careful for the first 3 months. Then onwards, like I usually say, after 3 months, your honeymoon period of the pregnancy begins. In the second trimester, the symptoms of nausea, vomiting usually settles down. There are very few investigations would we prefer. So basically, we do a sonography at around 18 to 20 weeks, and that's the most important sonography which is required during the entire pregnancy phase, and that's called the Anomaly Scan. So basically, this scan looks out for any anomalies in the babies, whether it comes to the limbs, it comes to the organs, and how the growth of the baby is happening. Like I already said, you can also do the triple marker or the quadruple marker if the dual marker was not done in the initial stages. Apart from that, once you cross the third trimester, once you cross the third month, we start with the basic iron and calcium supplements along with your folic acid, and this three continue throughout the entire pregnancy. Then, as and when we reach the 28th week mark, that's the third trimester, we do a sonography and we repeat the blood investigations. Basically, the blood investigation during that time, which you had done during the first ANC checkup, are the similar things which we are done, which we will be doing it right now again. Why? Because the placentation is complete, so we want to check whether everything is doing well. So we check on your sugars again, we check on the urine, the kidney profile, the renal profile, and your CBC, and that's the basic set of investigations which we require at the 7 month or the 28th week, along with a basic sonography which is called as a growth scan. At 36 weeks, we again do a sonography. That's the final growth scan, where we find out the position of the baby, the fluid around the baby, the position of the placenta, and what's the weight of the baby. So that's basically the final growth scan. So basically, in your entire 9 months, you require blood investigations majorly twice. That's once when you're pregnant and once at around 7 months. Sonography usually five. So one at 7 week, one at around 12 weeks. One is the anomaly scan, that's around 18 to 20 weeks. One is at around 28 weeks and one at around 36 weeks. That's the basic ANC checkup that should happen at everyone's level. Now, there are a few things which I have prepared for you, which I'll answer it out. So, coming to few questions which I get. So, the first question is, Doc, how much weight should I gain during the pregnancy? So, weight gain is very individualized. So, that depends on your BMI. BMI is basically weight depending upon your weight and your height. So whenever the first time when you find out that you're pregnant, that's the time we take your weight. And depending upon that weight, we calculate your body mass index. That's BMI. Depending upon your BMI, we tell you how much weight gain you're allowed in the entire pregnancy. It's usually said that you should eat well and you should gain a lot of weight, but that's not always true. Supposedly, if I get an obese patient, for my patient who is obese, in fact, I even tend to make sure that the patient can, if possible, lose weight during the pregnancy, keeping in check that the entire pregnancy is moving on in a healthy phase. For anyone who is in the normal BMI, that's between 18.5 to 24.9. For them, the weight gain which is allowed is between 18 to 36 pounds, calculating pounds is around half a kg. So that is the amount of weight gain you are allowed in the entire pregnancy. Ideally, in the first 3 months, that the first trimester, you are allowed a weight gain of between 1 to 4 pounds in the entire 3 months. From therein, every week you are allowed 1 pound of weight gain if you are in the normal BMI group. That's the weight gain which you're allowed in the total pregnancy. For anyone who's wondering where all the baby weight or the my entire weight is distributed, around 8 pounds of the entire weight gain roughly comes to baby weight. After that, whatever is remaining is distributed between your blood, your body fat which you gain so as to continue with the pregnancy and breastfeeding, the baby's amniotic fluid, the baby's placenta, and the growing uterus. That is how your body weight is divided during the entire pregnancy. Next question which comes in is, Doc, what diet should I be taking? Diet is basically a very balanced diet. Whatever you have eaten before pregnancy, everything should be fine and safe during pregnancy too. Make sure that have a balanced diet, but split it up into small frequent meals. If you keep on stuffing yourself with a large meal like the other family members might be having, you might tend to throw up very easily or you might have indigestion. So make sure it's small, frequent meals, but more importantly, balanced meals. If possible, if you have someone who is around like a nutritionist or a dietitian, get in touch with them so that they can figure out your entire diet plan throughout the entire 9 months. Next question is exercise. Exercise during the first 3 months is restricted. Like I told you, there shouldn't be any bumps, any jerks, or any sex. So, exercise is always basic routine, maybe some walking or being active. Basically, be active. See, very important when you look around, who all have the maximum number of pregnancies? Is it the affluent class or the laborers who are around you working below on the streets? So, the answer is the laborers. And do you think that they can be not working during the entire 9 months? No. So, whatever you're comfortable with, don't overexert yourself. If you're comfortable bending or squatting or whatever you're doing, continue doing that. There's nothing major drastic which has happened throughout the entire 9 months, or it's gonna happen. If by any chance your pregnancy is a high risk pregnancy, then we take a step back. But otherwise, continue doing a daily routine, whatever you're doing. Driving is fine. If you're driving to work, you're the safest person who can drive yourself to work. Driving is fine, cycling is fine, bending is fine, everything is fine. Apart from that, try including some basic activity, basic exercises if you're not very overly active. So be a 30-minute walk every day is something which is definitely recommended as per the guidelines. So this is something which I expect all my patients to do. Next in vaccines. So in the vaccine section, there are few vaccines which we definitely give in the pregnancy. So one is an influenza vaccine, which is given at roughly around 12 weeks. That's one of the vaccines. The second vaccine, which is more important, is the tetanus vaccine. Nowadays, we have started combining the vaccine. So we give you tetanus and a diphtheria vaccine. So ideally, a vaccine which is a tetanus and diphtheria vaccine is given roughly at around 7 months, at around 28 weeks, and 4 weeks following that, that's around 32 weeks. Those are the major vaccines which are definitely advised during the entire pregnancy. Apart from that, since it's a COVID time, a COVID vaccine is recommended. That goes as per your the national recommendation, and there's no change in that. Medicines, medicines which I've already discussed, the folic acid supplementation, which continues throughout your 9 months, the iron and calcium, which begin from the third month, that will go on throughout your 9 months. If anyone is taking any specific medication for anything like an epilepsy attack, like a stroke, or maybe because of asthma, so these medications will continue, but it's always better to have your doctor, as in your physician, and your gynec in a loop so that you know these things are safe for you and your baby. Coming to high risk pregnancies, there are few situations, basic situations, which we consider high risk pregnancies. One is Rh negative pregnancy. Rh negative is when your blood group is negative and your partner's blood group is positive. That's one thing which we look out for. In that situation, you might be given one additional dose of one injection, which is called anti-D injection. That's one thing. Second is sugars in pregnancy, what we call as gestational diabetes mellitus. In such situations, you might be started on some medications to control your sugars, or you might be moved on to insulin. Third scenario is pregnancy-induced hypertension. Very few pregnancies after 20 weeks show a rise in blood pressure, and that has to be monitored. Basically, that becomes dangerous because the baby size can become small. That's called IUGR baby, or you might land up with an epilepsy attack. So, your blood pressure needs to be well controlled. If you have a previous cesarean and now you're moving in for a cesarean, or now you're moving in for a normal delivery, so there are a few changes which we look out for, and that is how we manage your delivery. So, that again becomes a high risk pregnancy. Emergency situations where we would like you to contact us whenever you have any fever. So contact us. We have to rule out certain things which are there, and we tell you what medications, what antibiotics which you can take safely during the pregnancy. If there's any urinary infection, when you find any burning in urine, when you find any constant pain in urine, those things have to be reported. Urine infection most of the times can lead to preterm deliveries, which means delivery before the 9 months. So that is why urine infection needs to be treated. Any vaginal discharge, any vaginal redness, swelling, those things also have to be pointed out so that we can treat those infections. Again, these things are known to lead to preterm deliveries, therefore, we would like to treat them. If there's any bleeding, any watery discharge from the vagina, those things have to be told to your gynecologist. Otherwise, these things can be a silent indicator that you might be having some contractions, and that can lead to preterm deliveries too. So these are the basic things where we would like you to get back to us whenever there is some issue. So now we come to the myths. Myths are a lot. So whenever you have a pregnancy, you are actually brimming with questions, and most of them are surrounded by superstitions and the beliefs and the myths which have been followed from generation to generation. See, ideally, as gynacs, we usually don't like to disturb anyone's feeling and continue with whatever the family has to say. But certain things, as patients, we as doctors would like you to know that yes or no, these things are right or wrong. So, firstly, you have to understand that you don't need to eat for two people. You have a baby, and that supplements whatever you're taking, that supplements enough for the baby. So, in the entire pregnancy, you eat only for yourself. Majorly, in your second trimester, you can increase the calorie intake by only 300 calories, and in the third trimester, around 400, 450 calories, provided your weight gain is adequate during the entire pregnancy. So, you don't need to eat for two people, you just need to eat for yourself. Coffee, yes, coffee is allowed. You can take around 200 milligram of caffeine throughout the entire day. Make sure that you're not a hypertensive patient, a patient who has high blood pressure, so that the coffee intake can be curbed down a little. Alcohol, till nowadays, alcohol was actually allowed, wherein a one glass of wine was allowed during the entire pregnancy. You can take one glass of wine every day. But nowadays, we have realized that the metabolism of alcohol is different for different patients. And secondly, if I allow you one, you might want to ask me for another. So therefore, alcohol is yes or no, depending upon what your status is. Fourth, seafood. Yes, you can have seafoods. In fact, seafood or fishes are very rich in omega 3 fatty acids, and therefore that's good for you and the baby. But you should know that shellfish can give rise to some inflammation, some allergies. Therefore, avoid any uncooked food. So, any salads, any raw food, any shellfish which is uncooked, avoid those things. Papaya, pineapple, banana, everything is allowed. There are myths that this can lead to miscarriages. There's nothing like that, nothing which is proven yet. So everything, whatever you've eaten till now, like I've already told you, is allowed even during pregnancy. Cravings. Cravings are very common. Because of the hormonal changes which happen, your sugars go up and down, and therefore you crave for something sweet or something fatty. In the first 3 months, we allow everything, whichever you can have, because you are nauseous, because you tend to throw up, whatever keeps you happy and makes you gain enough weight and you're consuming that amount of calories, we are okay with it. After 3 months, we are a bit strict. But more importantly, cravings, we look out for something which is called as a pica. That is, eating of unhealthy. I've seen patients eating chalk or cement or even mud. If that is something which is noted, that's definitely need to be reported to a gynac. Apart from that, all your cravings, ice cream, sweets, Chinese, whatever you want, you are definitely allowed to have, provided that's not a regular appetite. Now, coming to morning sickness. The term morning sickness is actually a misnomer because you can have that sickness throughout the day. So, it's not just morning, it can happen over the entire day. Therefore, you tend to look out for it and inform your doctor. Take something which reduces your nausea. The medication can be taken 3 or 4 times a day. Hydrate yourself well. If you feel that you're throwing up even with water, add something to your drink, or maybe even add some Coke or Sprite or anything which keeps you hydrated and adds a good taste to your mouth. It's said that the morning sickness usually goes down by third month. Happens for many. For few sad patients, that can even last to the entire 9 months. So you take care of yourself. Exercise, like I've already told you, first 3 months, walk and a routine daily walking and routine brisk exercise and doing your home activities. After 3 months, ideally you should meet your ANC counselor who teaches you basic exercises which have to be done throughout the pregnancy. A bit of yoga, a bit of stretching, everything helps you to have a better pregnancy. Towards the end of the 9 month, that's the term, we tell you when to do duck walks and when to do squats so that that helps you to deliver vaginally better. Pets, pets, if you have had pets, they can be around you. Avoid the hair of the pets because that can lead to allergies or sneezing. Make sure that the pets are vaccinated well. And third thing, make sure that the feces of the pets are disposed of well so that you don't catch up any infection related to the feces of the pets. For the stretch marks are usually there, and that's nothing to be ashamed of. There are a few creams which are available in the market, which have the shea butter cream and the coca butter cream. You can apply that, and it helps in most of the patients. But again, like I said, it's not something that you need to be ashamed of. Can you do your hair dye? Yes, you can definitely dye your hair. Avoid any ammonical or excessive chemicals used in the hair dye product. Otherwise, hair dye is allowed. Traveling is allowed. You are safe to fly till the 32 weeks or 28 weeks, depending upon which airline you're flying on for. Traveling, make sure that you're taking not a very long journey so that you have facilities where you can pee. There are times when you have frequent urination issues, and if you don't have a proper outlet or you don't have a proper area where you can pee properly, you can catch infections. Therefore, keep the travel at a short distance. Sex is definitely allowed during the pregnancy, except the first 3 months. Make sure that whenever you're having sex, have it with a condom. There are certain products which are there in the semen which can stimulate the uterus and lead to contractions. And also, whenever you have orgasms, that can lead to mild contractions which are temporary and that will wear off. So, if you're comfortable and if your partner is comfortable, sex is definitely allowed. The pregnancy glow, well, that's a big thing which people are usually very proud of, the pregnancy glow, and some don't experience it. See, there are many things which happen in your entire pregnancy: exhaustion, anemia, tiredness, fatigue. So all these things can also take a toll on your health. So pregnancy glow is not always something which can be reflected. If you're having a healthy pregnancy, if things are moving well, that's all that we look out for. And last thing, can you predict a gender depending upon various things? Well, there is no documented evidence. We have heard that a fast heartbeat can tell you the gender of the baby, or the shape of the tummy, or the height of the tummy can tell you the gender of the baby, or the way the pendant moves. Well, there's no actually documented proof that this can happen. The only way we can tell you the gender, which we don't usually, is by a sonography. Otherwise, gender reveal is not something which we do. So that brings me to the end of the session. Basically, like I told you, you should understand that pregnancy is not a disease. The entire 9 months have to be lived happily and make moments which make you cherish the entire 9 months so that you move on to a better delivery and have a healthy child. That's all from my end. If there are any questions that we have, we can answer them now. The first question is, given my family history, are there any special genetic tests you think I should have? So, depending upon your family history, there are definitely a few genetic tests which we recommend. Firstly, if you have any chromosomal abnormalities which are running in the family, any genetic defects which are running in the family, we do a karyotype. That's your genetic DNA testing for you and your partner. If there is anything which is abnormal in that, then we counsel you accordingly. If not, there is something nowadays which are available that's called the NIPT. That's non-invasive test, wherein we take your blood and we find out the fetal DNA from your blood, and we check on the baby's DNA to find out if the baby has any genetic anomalies. Next question. Are there any activities, medicines, or foods I should avoid while pregnancy? Activities, like I told you, there's nothing drastically that you need to avoid. First 3 months, just be a little careful. Don't overexert yourself. Don't go beyond whatever your body is not allowing to you to do. Medicines, always, whenever you're taking any medications, the basic medication in pregnancy are the iron, calcium, folic acid. There's nothing else. If you're suffering from any disease, or if you detect anything in your pregnancy, it's always better to involve your gynec and your physician in a loop, and they decide which medications are safer for you. So that depends on which medication you're taking or whether we have an alternative to that. Any foods I should avoid during pregnancy? Like I said, no food has to be avoided in pregnancy if you've had that before you were pregnant. And avoid raw uncooked food, because that can lead to some infections which can happen to you. Otherwise, all three questions, I think that's answered. Next question. What do you recommend about exercise and specific foods I should eat? Exercise, ideally 30 minutes of exercise every day, 150 minutes of exercise over the entire week. That should happen. Brisk walking is something which we encourage. A basic thing, everyone has a mobile phone. Try to reach up to 10,000 steps every day. Do a little bit of squatting and the duck walking when you reach the 9 months. Be active. That is more important. That is something which we miss out on. Our parents, our relatives, or even our elders are so conscious that we are pregnant that they restrict your movement. But that should not happen. Like I told you, pregnancy is not like a disease. We have to be bedridden or we have to control on anything. Live your life. Specific food I should eat? There's nothing specific food that you should eat. Have a balanced diet, have a split out meal so that you are having small, frequent meals throughout the entire day. Whatever you like, whatever you eat, that can be continued. Avoid excessive fat, excessive carbohydrates if you can, but again, have a basic balanced diet. What are prenatal vitamins and why do I need them? So prenatal vitamins, basically vitamin B12 and folic acid are the major prenatal vitamins that we look out for. Vitamin B12 and folic acid prevents neural tube defects in the baby. Neural tube defects means defects which can lead to some brain or spinal cord anomaly. That is the most dangerous thing. So you're advised to take them as soon as you're planning for a baby or when you get pregnant. That is why you need a prenatal vitamin. Apart from that, the iron and calcium will have certain micronutrients which are there, and those are basically supplementations because according to the RDA, those are recommended. There's nothing specific apart from your folic acid, iron, and calcium. Iron is required because you tend to have low hemoglobin, plus your hemoglobin tends to go down when you're pregnant. That's called dilutional anemia and gestational anemia. So we would definitely like to see a hemoglobin of more than 10, 10.5 throughout the pregnancy. That is where we give you an iron tablet. Calcium, because the baby's bones develop during that phase, your calcium level tend to go down. That is why we give you a supplementation of calcium. What if the woman's blood group is O negative and the husband's blood group is O positive? Will there be a problem? So that is what I said, which deals with Rh negative pregnancy. Rh negative means when the woman's or the mother's blood group is O negative. If this is a first time pregnancy, as in when you're getting pregnant for the first time, then we give you something which is called as an anti-D injection at around 7 months. And then once you deliver, we find out the blood group of the baby. If the baby's blood group is positive, then we repeat the anti-D injection for you. Second timers continue the same protocol. Ideally, what's the problem is that if you have a O positive, supposedly the example which is given is the mother is O negative and the father is O positive. For example, if the baby turns out to be O positive, then there is an exchange of blood which happens between the mother and the baby, and that can lead to some antibodies in the mother, which can affect the next pregnancy or the next to next pregnancy. And then the baby has the next pregnancy or the next to next pregnancy baby can have some problems like jaundice or a fat baby because of some edema which happens or a swelling in the baby. That is what we would like to prevent. That is why the anti-D injection. I guess those are all the questions which we have for today. Thank you everyone for tuning in. Be happy, stay happy, have a safe pregnancy. Follow up with your gynec whenever you have any issues. And remember, you matter, you are important, and you are always heard. Thank you once again. Goodbye.